Everyone to today's CCHI community conversation, which we're holding in celebration of Women's History Month. And with us today, we have four wonderful women leaders of our profession and in general amazing individuals. And I'm going to give the floor to Carla Fogaren just so we can dive right into it. So Carla, please start.
Thank you so much. I really am honored to be considered a pioneer. As I was telling my fellow conversationalists, I looked it up to make sure that it didn't equal fossil in the industry because it's been 27 plus years that I've been doing this. So I wanted to welcome you all. I mean, to be in a group with Ira, Susy, and Beverly is just phenomenal. So I really appreciate it. And I'm going to do start off with my introduction, and then we'll go to Beverly, and we'll just get the introductions going. So my name's Carla Fogaren. I live in Massachusetts. I am a registered nurse by trade or by passion, and I oversee as the executive director of diversity, equity, and inclusion, the Stewart Healthcare System, and we have 35 hospitals across eight states. So I'm going to stop there, and I'm going to have Beverly go next.
Okay. Yeah, my name's Beverly Truman. I'm a Spanish interpreter. I'm certified by both of the national certifications, and I work with Healthcare Interpreter Network. I'm the program and quality assurance director. And it's really a pleasure for me to be here with people I really haven't had, except for Ira. Ira and I have hung out together at conferences and maybe had lunch, but we're meeting each other too.
Susy?
Yeah, thank you. Thank you for inviting me today. Susy Martorell. I'm currently retired in San Diego. I started entering the career of medical interpreting when I moved from Northern California to Georgia, to Atlanta, Georgia. I was a bilingual social worker in California, having learned Spanish living in Guatemala for 5 years. And then moved to Georgia and thought I'd continue as a bilingual social worker, and ended up being pulled over to interpret and entered the interpreting world, learned a lot, looked for training, and ended up becoming very involved in social activism in the community in Georgia because it was the dark ages relative to other parts of the country and responding to language needs. So I worked in hospitals and health departments in Georgia for over 20 years. And now in San Diego, I'm doing a little legal interpreting at the border for migrants. It's
Wonderful.
a pleasure to be here today.
Wonderful. Ira?
Thank you very much, Carla, and thank you all for joining us today. We really appreciate it and appreciate CCHI's community conversations. I think that this is fantastic and so happy to see my colleagues in the field. Of course, my name is Ira Sen Gupta, and I started in the field as a legal interpreter. Thank you, Susy, for mentioning the word legal. I was saying court. And so as a legal interpreter way back, I think in 1989, and or even before that, at that time, the only qualification required for an interpreter was to be able to speak languages. And I spoke 4 different languages, which is, of course, Bengali, my mother tongue, and then Hindi and Nepali, because I grew up in an environment where we just spoke Nepali. And so, but no guidelines, nothing of that sort. But that's where I first encountered, in a very real way, of course, being a woman of color and wearing a sari, I encountered this the minute I stepped into this country. That was 1972. But other than that, that's where I found the real inequities in the justice system. And I mean, it was so moving, and I'm sure all my colleagues and all of you have stayed in the field because of the emotion, the passion for change. And I moved from legal interpreting, and I would do deportation hearings and asylum hearings, and oh, my heart broke to see what was going on. And so I couldn't leave the field, but I had to at that point. And so I by chance moved into medical interpreting, and the circumstances were different, but the outcomes were not so different. And the issue of language access was so limited, and it caused so much of miscommunication and so much heartbreak that that's where I stayed, and I am there for now. And it's been about, well, was it 27 years for you, Carla? For me,
27.
I won because I've been in there for 80. I mean, no, not 80. I wouldn't be alive then. 7 years, and because I say in the field, I interpreted in multiple locations, and I interpreted in clinics, public health clinics, and also the municipal court, because they found me because I had those language skills, and they still call me.
Wow. Wow.
They still call me from Alaska. No.
Right,
Ira,
especially
that
with the
is-
languages you speak.
Yeah, and
That
then
is
had to
amazing.
become a translator without again any of the training, but because it was the passion that drew us. And so found that we needed to professionalize. And so that's why much of my work in interpreting, also I became the executive director of the cross-cultural healthcare program after serving on the board for quite a few years, and wrote curriculum. And it wasn't just me, but the group that you see and others like them and us got together, and we got a grant, and we met, and we wanted to say, where's the field? Is it a field? Is it a profession? We have to professionalize. And so that's where we all started writing curriculum that had standards, and then it evolved to many different ways, ending in certification. It was fantastic.
Absolutely. And that's a nice segue, because my next question was, and I think Ira already eloquently told us, but how did you get into the field? And for me, there was an actual aha moment where I said, okay, I'm either going to continue to whine about this, or I'm going to help be a change and improve things. And I was working as a nurse in a small Massachusetts hospital. And Susie, the only requirement was, do you have a pulse and do you speak another language? You did have to have a pulse, though. Okay. So then, they were constantly like trying to pull you. And in all honesty, my Portuguese was not my strongest language. And I had the medical terminology down being a nurse, but I didn't have it in Portuguese, right? So I really had that aha moment when I heard a doctor call in a environmental services gentleman who spoke Portuguese to tell a young woman that she had a cyst on her ovary. And he
Oh,
proceeded to tell her that she had a tumor versus quisto on her ovary, and that it's not a good thing because his sister-in-law died from it. So as she starts crying uncontrollably, the doctor's like, what just happened? I don't understand. It's not a bad thing. And that's when I just said, enough. Well-intended people sometimes do not help the outcomes. And I was very passionate about it, but I also knew that I knew nothing, and I didn't know how to approach this. But that was my aha moment, and that's when I truly started thinking, how can I change this? And I created a business plan that I presented to the vice president of nursing and said, we've got to do something different. And she said, well, why don't you do it? And I'll never forget that. So
that's the
how,
problem with
that's the
ideas.
problem. Do not volunteer them. How about you, Beverly? What was your
Did Susie
moment?
get to say? Yeah.
No, you,
Okay. Okay.
We're
I well, I learned Spanish because I was way back when, because I was interested in Mexico. I visited in Mexico, and then I was in Central America. I was part of efforts to stop U.S. intervention in Central America, and because I spoke Spanish, I served on. I was an interpreter in fact-finding missions. I went to refugee camps and had a lot of experience like that before I stepped into healthcare. And when I did start working as an interpreter in the United States, I did a little bit of court, but then working in healthcare, and I got my start at that in Minnesota, which was Minnesota. The hospitals in Minnesota already had a large number of interpreters on staff, especially Hennepin. Back then it was 30, now it's 100 and something.
Wow.
Yeah, and so and very, the hospital administrations there, I think, were very kind of aware of compliance issues. Then I moved to California, and I was really shocked here. I worked as an interpreter at a hospital, and wow, it my challenge, I think, was thinking, okay, what can I do so that people can understand the role of the interpreter, including the interpreters themselves? And I thought it was kind of curious because I thought, how is it that a refugee in a refugee camp can kind of instinctively knows what an interpreter is, and a doctor in a hospital doesn't?
Does
You know,
not.
like, yeah, it's sort of like, here, you go explain the lumbar puncture while I go get the needle. Like, what? Uh, you know, and I think it's that it has to do with that. It's just that, you know, things are the whole concept of equal access, that the interpreter is here to help ensure that the provider and the patient can communicate with each other. That's what we're there to do.
Yep.
And so that's what really drove me to be active in CHIA. I'm a founding member of the California Healthcare Interpreting Association. And California is a huge state, but it was the right moment. There were a lot of things going in our favor that helped make CHIA possible.
So true. How about you, Susy?
Shall I move on?
Yes.
Being my profession, social worker, but at heart, I'm very much a community activist as well, and which I think goes hand in hand with social work. And arriving in Georgia, which was in the dark ages in 1993, there were no interpreters in hospitals at that time, and not till about 5 or 6 years later. I was working in a hospital in the social work department, and I kept getting called on to interpret the different parts of the hospital, in the children's hospital. The only other person, staff person, who was regularly called upon was Noemi, who worked in housekeeping, who came from El Salvador a few years before and had about a third grade education. I was stunned that that she was being used as an interpreter and that I was being used as an interpreter, and I found problems, and I realized very quickly that I was a lousy interpreter. I spoke Spanish well, but I didn't know how to describe a lumbar puncture or get stuck in these problems of what you were asked to do that were unreasonable. Also, so that was a bit of my aha moment with Noemi and housekeeping. Also, that riding around Atlanta, I would listen to the radio, and there were advertisements from Taxis Cancun that they would go with you to your doctor appointment and interpret for you and do everything. Go to your lawyer, go to your doctor, go everywhere, and they would not only drive you there, they would go in and interpret you, and they did. And
In
the
what city was that?
That was in Atlanta, Georgia.
That's
Oh,
amazing.
Taxis Cancun advertised on the radio that they could take care of your interpreting needs with your doctors. And I was stunned because
wow.
I knew how difficult that was. And then being a social worker, I then went from the hospital to the public health system in Georgia for a while, early intervention program. And then later I ended up at Grady Hospital. I was there for 15 years. As a social worker, you're helping a patient navigate access, as we talked about, access through the healthcare system, and the barriers. It can be money, can be language, can be culture, can be so many things. I would see patients get discharged from different hospitals and then come into the clinic for an appointment and then get referred to me because they weren't following up on instructions from the doctor. Well, the instructions were handed over to them in English. And there was just a complete blind sight among the institutions in Atlanta regarding access by telephone, access by every person along the line in a hospital setting, paperwork that patients would get sent home with, and referrals that would be given. The ability to comply with medical advice was impossible. So I got first thing I did was look to find out how I could get trained, and went to CCHCP with Cindy Rote, etc., and to get myself trained, and then to look and find like-minded people in Georgia that we could work towards improving this language and cultural access issue that was for me, it was blaring loud horns, and for other people, it wasn't. And we needed to convince the community that that was needed. Community of doctors, community of patients, etc.
It's amazing because I mean the challenges that you've experienced, I think we all have experienced to a certain degree. As I'm thinking about the challenges, Ira, and how the profession or what we do has evolved, you know, one of the biggest challenges for me was that I was a clinical person. I was a nurse. So as a nurse, that quote became an interpreter by the skin of my teeth. Um, I had to really separate the two because you can't be both at the same exact moment. It's not fair to the patient. It upsets the whole apple cart as far as the triadic relationship. And there were moments where a doctor or another colleague might be saying something, and I kept saying, but say more because you're not giving them all of the information they need to make an informed decision. And as a nurse, I knew that there was more to it, but as an interpreter, I could only interpret the message. So it was really interesting process for me and very challenging. And when I joined the MMIA back then, which is now the IMIA, I needed some structure, I needed some help, I needed some support, some resources. Then I became more actively involved as a director and then the vice president of it. And then just recently, you know, not recently, my goodness, it's been 11 or 12 years. I helped to create an organization called Focus, the Forum on the Coordination
Oh,
of Interpreter Services. And that is like a support group, a super support group for all of the managers and directors of interpreter services. Because sometimes we exist in silos. We don't have any affinity groups or synergy with other people in our own organizations because they don't understand what we experience, what our interpreters are experiencing. So this has been a really good way for us to be able to support one another, share resources, and we now have members from all over the country that joined the group. But Ira, what were some of the challenges that you saw when you first came into, for instance, from an educational perspective, like what you were doing to help Susy and people like me learn how to be interpreters and learn how to be better leaders in the organization?
Before I go to the challenges, Carla and my friends, is that I wanted to say that I live in Seattle because I never said where I lived. And I've lived in Seattle for now 40 something years. So 48 years actually. And so it's, you know, but when people look at me, they think I just stepped off the airplane from India. So that's kind of nice because they're very surprised that I can even speak English. So the first challenges that I encountered in the clinic setting are many and the same as Susy, you talked about, and you talked about, Carla. The difference was that there was no recognition. That was one of the barriers, that we were a profession. We were smart, intelligent individuals that cared for the community. We were there not because of the money, and I think you know that is another big issue is compensation for medical interpreters. It's got much better, of course, but when we all started, the compensation was quite miserable. You had to have another means of income in order to follow your passion on this side. But we did it because we were determined to do it. And we together built those training programs. Ours was, of course, Bridging the Gap. And Susy, you mentioned one of the writers of Bridging the Gap. But it, of course, all of us put it together and wrote that. And we have continued to, you know, stay with the flow and stay with the needs of the community. And mental health issues have become a huge problem and a challenge. So I think we all have done that around the country. Everyone has. So that's what I want to stress: is if we didn't have that sense of camaraderie,
right.
I don't know that we would be able to do as much as we have done. So, you know, for those who are starting in their career, it's a fantastic career.
Yes.
And we said that to everybody. And we had to prove that it was going to be, because for interpreters, getting caught in the middle is sometimes the most difficult challenge. When you're a witness to racism, when you're a witness to exactly what Susy said, that is when you waver what you're going to do. And one thing that I want to say is that the associations that you talked about, Carla, I am so thankful that we had started to build the associations that we've built. You know, National Council, IMIA, CHIA, you name it, TAHIP, you know, you've got all these councils. And we also started in Seattle, it was the second interpreter association in the country called Society of Medical Interpreters. Interpreters didn't know what they wanted to do, and they didn't know if they had these rights. And he said, yes, you do, and you are a professional. So,
Right, that's what, oh, sorry.
no, I just wanted to share that with
Okay.
you.
Yeah, that's what I'm so proud of is, and I feel so fortunate that I think a lot of us started out with other people telling us what to do and not do. Doctors
Yes.
saying, don't interpret that. I didn't want the patient to hear that. Or social workers or any number of people would, but hospitals they don't really they have administrators who know how to run a hospital, but they don't have language expertise as something that's native to their organization. And so we as interpreters, we took control of this field. We figured out, okay, we need training, we need ethics, we need standards. Okay, we need certification.
Right.
Okay, we need continuing education. So all of these things have happened, and they are, you know, the organizations you named. These have happened over these many years, and it means we have a lot of consensus in the United States now among interpreters about what interpreters do and don't do. And it means I can talk to interpreters in Minnesota or Massachusetts or California, and they've all had similar trainings, all based on the original, Bridging the Gap. I think it's all derivative. You guys should have had royalty rights or something, but that's a good thing, and that we have this consensus. And I say that because now we have the technology. If the technology had been introduced first,
Right.
before we had defined healthcare interpreting, we would have a big mess in this country. But because now we're just, okay, we're bringing technology into what we do, but we already know what we're doing. And I think that's thanks to the work of people like us and people, it's been hundreds of hours, often volunteer hours, that have gone into this. I think a lot has been accomplished.
And to that point, Beverly, if you think about it, that I think there's such strength in standardizing the approaches to interpreting services. So, for instance, your organization, you know, providing interpreters in Massachusetts, in different states. I mean, if we didn't have that common ground where we stood by our standards and our ethics, then you couldn't do it.
Right.
Because they'd be complaining left and right. Well, Mary, when she interprets, she does this, 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 and that. And then, you know, Susy does something different. So I think for me, the biggest challenge in supporting our interpreters is just to, you know, encourage them and recommend to them, please get certified, continue your education. And I think one of the challenges is that it's not being mandated by certain states. Like our state, Massachusetts, says that they're going to put that as a mandate. But if something is not truly required, then hospitals don't necessarily support the certification process because it's not mandated or required, you know. And then the other challenge is we don't get reimbursed for interpreter services in most parts of the country. Susy, I don't know about in California necessarily, but do you have, you wanted to add something, Susy?
Well, I was going to add a little bit of the challenges. Thank you, Carla, in that um, and Beverly mentioned this, the challenge is getting institutions and people in power to realize, doctors, et cetera, that this is really needed and this is really important. And in Georgia, we were so behind the rest of the country. Ming was formed in 1999, our Medical Interpreter Network of Georgia, but we were looking to CHIA and looking at MMIA and looking at all the other groups around the country to learn what to do. But within our state, to get appreciation for the profession of interpreters and the need for language access. We were very lucky to get a foot in the door when Tom Perez, who is the DNC chair, but at that time, he was the head of OCR in the DC area, the National OCR office. And he came to Atlanta on a visit. And another social worker in the hospital told me, Tom Pettis is going to be there, OCR, let's go down. And so some of us who were like-minded activists in the community went down to his sort of town hall meeting in downtown Atlanta. And we brought evidence. We had documented and compiled evidence of what we were seeing happening in the community. And that was the jump start for us to make a relationship with the Office for Civil Rights in Atlanta, which led us to filing a complaint against the Department of Community Health and the Department of Human Resources, a civil rights complaint in Atlanta in 2006. Then in 2008, we filed a complaint against Grady Hospital, which at that time was my employer, but they kind of never put two and two together and figured it out, I think. But that made a huge difference to file an OCR complaint. And some people were saying, no, we shouldn't do it. But at the time, I thought it was right. And to look back, it changed the whole scenario. And they set up a language barriers team, of which we were participants down at the state offices, to work on making a plan for all the services to get Medicaid and food stamps and Department of Family and Children's Services. So if we hadn't had that luck of the Irish foot in the door with Tom Pettis that led to connections with OCR, Atlanta Legal Aid provided the legal support for us. This is all free service people were doing as volunteers and pro bono, and it was it really spoke to the challenges we had in Georgia of not recognizing the need for access.
Well, but that took courage. That wasn't just the luck of the Irish. That took courage and resilience, right? And I think that that's, how to support the LEP community. I mean, the LEP community is our community. It's not them, it's us, and we're such a blended group of people now that we have children who are marrying people from other countries and other races and ethnic groups and from everywhere in the world. So I think that, I would strongly advocate that we continue to push and stand strong on what we know is right, not just, as a person, but when your opinion counts or your vote matters, then use it, right? Now, how would you guys
We have 3
think?
minutes left.
3 minutes. So this is
Okay.
the last question that we'll probably get in.
Okay.
So I'm going to ask you, Beverly, and then Sue. We'll just go anybody that wants to talk. What would you think is the number one thing we could do to support our interpreter community, our interpreters themselves, especially through what I call the 15 months of 2020, the COVID year?
Well, okay. I thought we were going to talk about LEPs, but to support interpreters, I think we really have to be mindful of their morale. Interpreters do a good job because their heart is in the work. It's that heart that says, I hear a message, I convey it accurately and completely into the other language because I care. And so we really need to have organizations that support the morale of the interpreters, because if the interpreters ever feel beat down or forgotten or disrespected, they're not going to be able to do a good job over time.
How about you, Ira? Any suggestions on this?
I think training available and affordable, and much better compensation is how we're going to support interpreters who ultimately support our LEP communities. And that's all in there. The other thing is, I just wanted to say one thing and then just throw you a quiz question. Okay, friends? So the one thing I wanted to say is, I'm no longer the executive director of the cross-cultural healthcare program, CCHCP. Been there for so many years. I thought new hands should come on board. And so we have a fantastic team of Paulina Bandiana, who is our executive director and a trainer and an interpreter in Spanish. And then of
We have
course,
about 30 seconds. We're not going to finish.
Thomas Johnson, another member of the team and director of the language programs, and also Brian, director of the Equity and Inclusion. So just wanted to share that with you. Here's the quiz question. 15 seconds. We have run into so much of bias wherever we've presented, whatever we've done, right, friends? And people have said, why should we pay you to interpret for these people? Anybody who lives here, comes to live here, should know English. I said, okay, let me ask you a question. And this is a question to you. If a patient from Kentucky, born in this country, comes to the clinic and says, who of you may remember this? I got a pone on my head and my leaders are all balled up. Interpret that, friends. Now tell me who needs an interpreter.
So
Mm.
true. So
Actually,
true,
to
Ira.
everybody, and in the group, everybody is attending. So tell me the answer if you don't already know it, but if you know it, you're genius. So thank you so much. That's
Thank you. And Susie, I'm sorry, we're right on time. Did you want to say one last thing, Susie, and then
One
we'll
quick
You should
thing,
let her go. They're not going to
very
turn the thing off. Just go ahead.
very quickly, being a person in retirement and looking forward to extend some of that activism or passion from the past, get involved with other partners in the community that are dealing with and cognizant of LEPs and the issues, but that you can add more information to the scenario. So I worked with League of Women Voters, I Planned Parenthood, Jewish Family Services, Catholic Social Services here in San Diego as a volunteer. And I know that people can't find extra time when they're not retired, but look for opportunities in your community to connect with other segments in the community that might have a good listening ear and an interest in promoting interpreters and their profession as it should have respect and attention.
Well, this has been wonderful. I wish we could have shared that cup of tea. I want to turn it over to Natalia now, but thank you so much, everyone. I really
Thank you,
appreciate it.
Carla.
And thank you, the people that joined.
Oh, thank you, everyone. Carla, Suze, Beverly, Ira, as I started this conversation saying that you are our heroes, you are our mentors, and I am so impressed with the passion that you're still carrying for the profession, because you're correct. It's passion and courage, because each one of your stories shows that it's not just being excited about something, but actually doing about something. I have a lot of comments from our audience. Thanking you for your contribution to our interpreting profession. Thanking you for your leadership, for your passion, and I wish you many more years of leadership and involvement, and we hope to meet for other conversations in the future. And everyone, have a wonderful day.
You as
Thank
well.
you.
Thank
Take
you.
care. Bye bye now.
It's fun.
Bye.
Okay.
Bye. Bye.